Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon, everyone, and thanks for being here. Today is World AIDS Day, and the theme of World AIDS Day this year is human rights and access to treatment. Health care providers can play a critical role in identifying and helping to confront and reverse the HIV epidemic by testing more people, linking them to care, helping people who are positive not only stay healthy, but also not put themselves and others at higher risk by reducing their risky behavior, and by ensuring that people are educated and get the treatment that they need. One of the things that people with HIV benefit from, as do other people with chronic conditions, is the H1N1 vaccination. And giving our update now on H1N1 and turning to H1N1, I think the basic perspective for today is that we are in a window of opportunity. We're going from a time where there was lots of disease and not enough vaccine to a time where disease is gradually decreasing and we're having a steady increase in the amount of vaccine that's available. That gives a window of opportunity for more people to be prevented by getting the vaccine, to be protected, by getting the vaccine. The flu virus is unpredictable. We can't be sure of what will happen in the future, but we do know that we can provide you with every piece of information that we have about what's going on today. There's been a decline in activity, but there's still lots of flu. Flu is widespread in 32 states, and we'll show a slide which will be available on the web that we'll put up now, showing flu activity last year at this time compared with this year at this time. And what you can see is by end of November, early December, there was very little flu last year. This year we have widespread disease in most of the country. Although flu is going down, it's far from gone. And flu season lasts until May. Only time will tell what the rest of the season will bring. There's still lots of kids who are sick and lots of people who are at risk of getting influenza and of getting severely ill from it. One question that all of us naturally have is, will we have another wave or another large number of cases in the months to come between now and May? We took an informal poll of about a dozen of some of the world's leading experts in influenza. About half of them said, yes, we think it's likely that we'll have another surge in cases. About half said, no, we think it's not likely. And one said, flip a coin. We don't know what the future will hold. What we can do is track very closely so that as the cases develop or don't develop, we can determine where they're occurring and what their characteristics are. It's important to remember that in the last pandemic that behaved this way, 1957, 1958, more than 50 years ago, there was a large surge in cases at the beginning of the school year, then a waning of cases, and then in December, January, February, there was a big increase in number of people who were severely ill or died. We don't know if that will happen this year. We do know that vaccine is the best way to protect yourself. With the virus changing, it's important that we continue to track it. And I want to take just a moment to outline some of the ways that that happens here at CDC. As more people develop influenza infection, there's more chances for the different virus strains to change and evolve. And as more people become immune to it through either vaccination or infection, there's a pressure on the virus to change. Scientists at CDC's influenza labs work extraordinarily hard and with an enormous level of knowledge and expertise to track what's happening. We have about 100 people working in our flu lab directly and nearly another 100 who work in areas that are closely related to the influenza laboratory work. We know, for example, through their work that the virus remains very well matched to the vaccine that we're using. We also know that even if the virus were to become more deadly, this vaccine would likely work on less parts of it that affect the vaccine change. In other words, the parts that make of the virus that make it deadly are different from the parts that the vaccine uses to protect us. We also know that resistance remains rare. And recently there were reports in the press of a mutation in Norway and other parts of the world that appeared to be associated with more severe infection. And while there's a lot that we still don't know about this particular strain, there's a lot that our laboratorians, our scientists, knew very promptly. And we can show on the web, and perhaps the next slide, just how sophisticated some of the laboratory work is. This shows the actual geometric conformation of the virus and of the receptor cells within the human lung, and indicating in red the part of it that changed and why it meant that this particular virus strain was more likely to be found in lower parts of the lung. And while that may have seemed concerning, in fact, we've found this type of virus, our laboratorians have, since early on in the outbreak. It's present in less than 10% of the very severe or fatal cases, and we know that H1N1 can cause deep lung infections without it. Also, selection of this sample may result from how the samples are collected or handled in the lab, and we haven't seen any clusters, nor has it been associated with resistance or any change in vaccine responsiveness. So this is all by way of saying it's interesting, but at this point not something that we should be unduly concerned about. And it's an example of the superb work that our laboratory, and really a global network of laboratories that works together to find and find out about H1N1 and other flu viruses. I wanted to just take a minute to recognize and thank them for their superb efforts. With increasing amounts of vaccine available, it is a window of opportunity for protection. There is now nearly 70 million vaccine doses available, and we're seeing that more people are getting vaccinated, more people are getting protected, and as that happens, it's harder for the virus to spread. Increasing supply should lead to increasing ease of getting vaccinated in many places, but we know it's still far too frustrating. We know that there are lots of people who want to get vaccinated and haven't been able to get vaccinated yet. We know from polls that 9 out of 10 people who had had trouble getting vaccinated said that they'd try again. And now is an increasingly good time to try again because vaccine is increasingly available. We're seeing variability. Different places are different. Some states have more virus activity. Some states have more media coverage of people who are sick. Some states have a tradition of taking vaccine more than others. And some states are having experiences where they're getting school kids vaccinated and holding back some of the vaccine from doctors' offices. Other places are mostly working with doctors' offices and not so much with schools. So there are differences in different places, and those are understandable differences. There's not one perfect right answer of how to vaccinate. And one of the things that we do is to look carefully at what we know and what we don't and what we can learn about how it works to vaccinate people, and what's the best way, for example, to get school kids vaccinated, where different areas may have different approaches. Different ways to get pregnant women vaccinated. We urge all obstetricians to carry the vaccine and to vaccinate their patients. But we know that that's difficult, that having a separate system, a new refrigerator, supply, some of the administrative demands are challenging, and it's hard to get that up and running. So at least every obstetrician should ensure that they know how their patients can get vaccinated easily. That variability is both a challenge, but it's also understandable, and it's one of the things that helps us learn better ways to do it and allows creativity at the state and local level to reach out to groups that are harder to reach, to vaccinate people who would like to get vaccinated but may not be willing to go out of their way to get vaccinated. I think in the coming weeks we'll see increasing vaccine availability. We'll see places that have more vaccine than they can easily use. At the same time, we'll see doctors who wish they had vaccine and patients who wish they could get vaccinated. So it continues to be a challenging time. We continue not to have as much vaccine as we would like to at this point. And the recommendations of the Advisory Committee on Immunization Practices provide flexibility for local areas to do what's best to protect the people in their community. I'll also note that about a quarter of all the vaccine that we have available is in the form of nasal spray, which is available for people aged 2 to 49 who don't have underlying problems, and is believed to be highly effective, and it's one less shot. We've heard about reluctance on the part of healthcare workers and others to get the nasal spray, but there's really no reason to be any less confident in it than any other flu vaccine. In summary, we don't know what the future will bring. We do know that we have less vaccine now. It is a real window of opportunity to get vaccinated in the coming weeks and months. And vaccination remains our best protection against the flu. And for people who are sick, it's important still to get prompt treatment.